My name is Rotarian Ejiofor Daniel. We are here at Aguotu Health Center, a global grant that we commissioned on the 5th of July 2022. This global grant came as a result of partnership between Rotary Club of Abakaliki and Rotary Club of Cupertino, California, USA. Other Rotary clubs also contributed to this global grant. This global grant was awarded by Rotary Foundation in May this year. AMURT Foundation is our implementing partner, and this is the 6th global grant that we have done with AMURT Foundation, and also the 3rd that we've done with Rotary Club of Cupertino, California, USA. Rotary received applications from several communities in Ebonyi State with respect to primary healthcare interventions. We selected this community due to complete lack of access to primary healthcare, and then the commitment shown by the community leadership in the upgrade of this health center.
At the inception, we had MOU. We signed it with AMURT, Rotary, and the community and government. It was stated that the community will renovate the hospital. Now, on the side of Rotary have equipped the hospital. Then on the side of AMURT, they have brought in the manpower, the doctors, the nurses for the running of the hospital. And we are prepared to protect whatever equipment that is being brought to the village.
On Tuesday, 5th, that we declared this place open, up to 86 pregnant women came for an antenatal. Before now, the ANC record from their register run between 10 pregnant women to 20 pregnant women, but in July alone, up to 133 pregnant women were attended.
The global grant provided funds for community mobilization and outreach in over 20 villages covering the whole of Ogboji Community. Local volunteers were recruited and conducted an enumeration of all women of childbearing age in Ogboji project area. Maternal health promoters were elected from each village, and they received a 1-week training. The global grant also funded a 1-week training of health workers. They are 15 in number. This is to ensure that the health center will be open for 24 hours of every day. The health center is a community managed. A clinical management committee was selected, and they also received a 1-week training on health center finance, drug revolving fund, and key administrative responsibilities. The global grants paid for hospital furniture, including beds for the wards, examination couches, benches for the patient, shelves for the pharmacies, and working tables for the lab. Laboratory equipment, ultrasound machine, and all basic medical equipment for the use of the doctors and nurses were also provided by the grants. An opening inventory of drugs, laboratory supplies, and consumables, general supplies were also bought with the help of the grant. A drug revolving fund has been put in place to maintain the stock of all essential commodities and supplies needed for patient care and daily operations. The grants also paid for drilling of a borehole, a water tower with overhead tank, and a pipe water to the health center rooms and bathroom facilities, along with a generator for lights, pumping of water, and operation of medical equipment.
Ever since they brought this hospital here, it has been helping us. It has been helping a lot of people, both pregnant people and sick people.
We share the efforts of the AMURT and the Rotary International in this facility. Before, we don't have an access of this kind of thing in our village, because our women, they used to die in labor. We used to have stillbirths, but since the inauguration of this facility, we have a great positive change.
On behalf of Rotary Club of Abakaliki, we want to appreciate Rotary Club of Cupertino, California, USA, and all the other contributing Rotary clubs, and most importantly, AMURT, for ensuring the sustainability of this project. Thank you very much.